Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. How to detect prostate cancer in early stage? What is prostate? Prostate is a rubbery gland situated below the bladder at the root of penis and in front of rectum in male. It looks like a walnut. It weighs about on average 11 gram. Range may be from 7 to 16. Can a person live without a prostate? Yes, but his reproductive power would hamper seriously. Now on the right hand side there are three pictures. Just note, this is bladder and urethra. This is urethra, and this yellow thing is prostate gland. Urethra is this thin line, and this is the prostate gland and these seminal vesicles. There are two seminal vesicles, one this side, another opposite sides. This is the same prostate, but the position of penis and prostate gland has been shown here. The relation this is bladder, prostate, penis. Now here this is prostate, this is bladder, this is the rectum. So in front of rectum, at the root of the penis, below the bladder. These three positions have been shown in these three pictures, and this is the shape of a walnut. This type of shape, slightly angular, but almost this type. What are the functions of a prostate? Secretion of prostatic fluid, a part of semen. On the right hand side below, the semen constituents have been given. Together with sphincter muscles of bladder, prostate closes the urinary duct during ejaculation. Closes duct of seminal vesicle during urination. See, this is the male urethra, and the passage of semen are the same. So when semen is going, urinary duct should be closed, and when urine is going, the ejaculation should be closed. This thing are controlled by prostate a lot of with the help of sphincter muscles of the bladder. Produces enzyme like PSA, PSA, prostatic specific antigen, prostate specific antigen, and hormone like substance spermine, which helps in fertilization. Fertilization means fertilization of the egg in the fallopian tube. There, this PSA and enzyme helps, and these are being carried by semen. Semen includes PSA, spermine, as also sperm cells. And sperm cells actually fertilize, but this too helps in fertilization. Maintains erection of penis during coition. That is, prostatic muscles helps. Finally, it produces the during ecstasy. Semen comprises sperm cells, secretion from seminal vesicles, prostate containing PSA, spermine, and bulbourethral glands. So there is a small gland, bulbourethral gland. This is situated just below the prostate. This is not absent in the picture, but it is that. It is like that. What is prostate cancer? When cancerous change starts taking place within prostate gland, prostate cancer results. Cancer is nothing but uncontrolled proliferation of malignant cell at the cost of normal cells. This is the definition of cancer. It is everywhere the definition is applied. Here also the same thing. The malignant cells are increasing, killing the healthy cells, and this process goes on relentlessly, continuously. This is cancer. Prostate cancer is a very common cancer. This is the most important thing. It is a very common. Actually, it is second to skin cancer. Skin cancer is the most common. It is second to skin cancer. It is estimated that 1 in every 9 men fall prey to prostate cancer. Note here the high percentage. Every 9 out of every 9 men, 1 man would be affected by this particular cancer. Many prostate cancer grow slowly and remain confined within itself without causing much harm. There is a lot of, a good chunk of prostate cancer are generally harmless, but there are other types too which are very aggressive and spread very rapidly. Actually, spread means metastasis, and metastasis is the most dangerous thing. So if prostate cancer, the type of prostate cancer which doesn't, which cancer which do not metastasize, they are good. They are less harm. Trouble is much less in that cases, but which are aggressive, spread rapidly, they are very much dangerous because this will be moving to bones, livers, lungs, brain. So that is a very dangerous thing. That's metastasis is very dangerous. Prostate cancer detected early have very high chance of cure. Very high chances of cure. This is picture where the cancer is started already within the prostate. What are signs and symptoms of prostate cancer? Prostate cancer may have no signs of symptom in its early stage. This very peculiar thing, none. However, in advanced stage, the following symptoms appear: trouble urinating, blood in urine, blood in semen, erectile dysfunction, bone pain, losing weight. When to consult a doctor? If any of the symptoms above worry you persistently, you must consult a physician. What is the cause of prostate cancer? No true cause of prostate cancer is known still today. What are the risk factors of prostate cancer? Age. Chances of prostate cancer increases with age. Race. Black people are prone to be attacked with ailment than others. This is, see, high age, black people. Family history. If a blood relative had been attacked earlier, persons in the downstream are more likely to be affected. Obesity. Obese persons are very much prone to catch this disease. Obese persons usually catch, they are affected with this prostate cancer very often. How to prevent prostate cancer? Stop all sorts of addiction, sun, meat, processed meat, alcohol, completely. Meat, especially red meat. Control taking all foods and drinks that causes chronic inflammation in body, like coffee, dairy products, chocolate, cookies, cakes, sweets, refined carbs, all fried foods, carbonated, caffeinated drinks, food with trans fat. Mind this, these foods cause chronic inflammation. That doesn't mean that you never take it. You can take chocolate once in a week. You can take refined carbs. You can take fried food packets also, but you should not take it regularly and at a high rate. Avoid being a night watchman. That is, night watchman means, I want to say that don't keep watching late at night. Take sleep as early as possible. Practice physical exercise daily so that few drops of sweat come out your skin. This is a very important thing because prostate dependent on actual physical exercise also. Get enough fresh leafy veggies, fruits, fishes, nuts, olive oil, fat-free milk daily. Following 6 foods are considered prostate friendly food. Mind it, following 6. What are the 6? Berries, all types of berry, blackberry, strawberry, raspberry, beans and nuts, citrus fruits, walnut and almonds, green tea and watermelon. I have shown this picture down 1, 2, 3, 4, 5 and 6. These are called prostate friendly food. Take this food as much as possible. No control. You can take regularly this melon. You can take regularly these berries. Go to sleep early 9:30 p.m. and get up before rising sun. That's a very good sign for health. For good health, this should be maintained. Do not indulge in promiscuous sex. Control your sex life. This is another very important thing. Foods that fight inflammation. This is the food. I have collected this pamphlet from internet. Anti-inflammation food, tomatoes, all sorts of fruits, nuts, fatty fish, leafy greens, olive oils. These are anti-inflammatory and these are inflammatory foods. This is the fried foods, soda, refined carb, lards, processed meats, and so on. What are the premonitory signs and symptoms of prostate cancer? Premonitory, these are the most important symptoms. Actually, generally prostate cancer is symptomless to start with. However, the following signs may be there: burning or pain during urination every time, difficulty urinating, problems starting and stopping while urinating, more frequent urge to urinate at night, including false urge, loss of bladder control, erectile dysfunction, loss of libido. This is a slightly late symptom. The first 1, 2, 3, this 1, 2, 3, this 1, 2, 3, these are really premonitory symptoms. And loss of bladder control also. But erectile dysfunction, loss of libido will come when it is already affected. Painful ejaculation, same thing. Blood, same thing. It is almost slightly advanced stage. Weakness and general malaise. It will start from beginning. You can take this thing at this position also. The weakness and general malaise. This thing you can take here. What are the advanced signs and symptoms of prostate cancer? Persisting bone pain, eventless fracture. That is, the cancer cell has reached bone marrow. That is, metastasis to bone has occurred. That is, it is an advanced stage and it is very difficult to cure this patient. And there will be fracture without any event. That is, slight pressure will fracture. Generally, bone is tough. It takes a lot of pressure, then it go into fracture state. But here, fracture will come naturally. Slight pressure from slight. Numbness, pain in hips, legs, feet. That is, nerve has been affected. Since the cancer cell are spreading, nerve has been affected. Swelling in legs and pelvic area. That is, these cells, cancer cells, metastasis cancer cells, have clogged the venous system, or rather the circulatory system in the body, so that swelling, that is, circulation is disturbed, and swelling legs and pelvis area happens. The swelling happens due to venous drainage, disturbance in venous drainage. Since veins are already been affected with cancer cells, so there will be swelling legs and pelvic area. This picture has been shown here. This is edema or venous block of this swelling of legs. This is the bone pain. With this, the video ends. Thanks for listening and viewing.